Hello, everybody, and welcome back to Long COVID MD. I'm Dr. Zeest Khan. We have been on a little bit of a break the last few weeks, and we're back with a new episode about IV fluid hydration for long COVID. This episode is actually a video that you can find on YouTube, so I do refer to things like watch the next video or keep watching, and that's why I talk on this episode about the use of IV fluid, how it's different in the hospital setting, in sort of an emergency, and as an outpatient using hydration clinics or med spas to give yourself a little bit of a boost, especially when you're feeling particularly unwell. We talk about the science behind that. I review some of the literature that is available, and I walk you through my thought process and rationale of when I use IV fluid to help me feel better. So let's get into it. I don't know if it's karma because I've put thousands of IVs in people, but now I am getting IVs for my long COVID symptoms. But I get them very specifically, and I've reviewed the research on them, and you might be surprised by what the research says versus what I actually do. If you're interested in learning more about long COVID and the use of IV fluid to treat symptoms, keep watching. We're going to go over the research and the ways that you can decide if it's right for you. If you're new to Long COVID MD, hello, I'm Dr. Khan. I am a board-certified physician who got long COVID in 2020, and my life got turned upside down. For the last few years, I've had a podcast sharing my experience and explaining the ways a doctor approaches a mystery illness like long COVID. We cover the science of long COVID, what we know from before, what we know now, and focus on practical tools that you can actually implement and access. We are talking about long COVID in the real world. So subscribe to the newsletter if you want to hear more. Subscribe to the YouTube channel too. First time I got IV fluid, it was in an urgent care center, and I was scared. It was 2021. I was feeling miserable. I could barely get out of bed. I was dizzy. I was fatigued beyond description. I was confused, and I didn't know what else to do at home that might help. And that's saying a lot because I've taken care of critically ill patients. I've been a physician for more than 10 years, and I do a lot to take care of myself at home to prevent having to go to the emergency room. But I couldn't avoid it this time. Instead of an ER, I went to urgent care, and I told my doctor about my symptoms. They checked my vital signs and examined me and found that, sure enough, my heart rate was really high, which might have been causing my chest pain. My blood pressure was pretty low, and they administered IV fluid, in addition to running some other tests. After a couple of liters of IV fluid, I was feeling so much better. I could speak more clearly, think more clearly. I could stand up without feeling like I had to pass out. And what I was very happy for was that the doctors and the staff at the urgent care center were able to run tests to make sure that I wasn't having an acute medical event like a heart attack or a stroke or an arrhythmia. I went home after that. I still needed a lot of rest. It was 2021. I was spending most of my time in bed anyway, unfortunately. But that IV fluid really stopped a downward spiral that I was on. I was experiencing a long COVID crash, a long COVID flare, post-exertional malaise, or a worsening of my chronic symptoms. Whatever it was absolutely frightening, and I couldn't continue without urgent medical intervention. Since then, my health has, thank goodness, improved substantially, and I've learned how to pace my energy so that I avoid overdoing it and crashing. I'm not perfect, however, and I still have long COVID. So from time to time, I experience a flare in my symptoms. These days, because my baseline health has improved and because I'm not experiencing a medical emergency, I visit IV hydration centers. So we're going to talk all about what these IV hydration centers are. But essentially, they are freestanding clinics that are managed by a physician and staffed typically by registered nurses, where I can receive an IV fluid, and sometimes additives too, like vitamins and extra electrolytes. I pay for these out of pocket, and I get screened for my health to make sure I qualify for this type of outpatient IV hydration that doesn't always have a physician looking over you and doesn't provide medical tests or further medical intervention. So the first point to remember is that you have to be well enough to be safe for IV fluid outside of a medical facility. Now, these are facilities, IV hydration centers are facilities that have a medical license attached to them, but they are very low acuity medical centers. Oftentimes, they are advertised as wellness centers. They might provide or offer cosmetic services like Botox and lasers, and sometimes they're marketed towards athletes who want to recover a little bit more quickly after their exertion or a race or training. You'll typically get checked in. Your health is going to be assessed. You're going to be triaged to make sure you don't have any contraindications to getting IV fluid. That means major medical conditions that would make it dangerous for them to treat you. And then you meet your nurse, you get your IV placed, and you chill out in a comfy chair. Sometimes they give you a blanket, and you get your IV fluid administered. After that's all done, they take the IV catheter out and make sure you're doing okay and let you go home. I'm going to talk about every step along the way of this process. But first, let's talk about how IV hydration could help your long COVID symptoms. So IV hydration increases your blood volume, and people who have dysautonomia or an abnormally functioning autonomic nervous system, that's the part of the nervous system that helps control your heart rate and how much your veins or arteries dilate and constrict, how your lungs open and sort of close in response to changes in your position and changes in your activity, stops working as well. Either the messaging is not working right or the function at the end point isn't working right. We still aren't sure what is happening in long COVID to cause dysautonomia, but we do know that there are a lot of people with dysautonomia or a lot of people with long COVID who are suffering from dysautonomia. If you're interested in learning more about this, you can listen to my podcast episode with Dr. Alba Azola from Johns Hopkins University. She is specializing in dysautonomia in people with myalgic encephalomyelitis, chronic fatigue syndrome, and long COVID. So listen there for more, and you're going to learn a whole bunch. The research we have so far, even before COVID came onto the scene, suggests that people with dysautonomia have low blood volume and respond to increasing their blood volume and to have a better quality of life and a reduction in their symptoms. So blood volume is the combination of two things. It's blood cells, that includes your red blood cells that carry oxygen, white blood cells that help fight infection, and platelets. And then there's another component called plasma. Plasma is like the carrier fluid of the blood cells. It's mostly composed of water, but it also contains electrolytes and some really important proteins. IV fluid increases the plasma, essentially, and your blood volume then expands. Why is this important? Well, if you have normal red blood cells, so you're not severely anemic, your blood volume is going to determine how much blood and how much oxygen gets to your organs. That's really important. And what we're finding is that some people who have an increase in their blood volume and have long COVID symptoms, like brain fog, might benefit from the increased blood volume and oxygenation of the brain. Increasing blood volume can also improve perfusion to your liver, to your kidneys, so they can help continue to clear metabolites that might be building up. The other potential mechanism is that by increasing the blood volume, we're compensating for abnormal pooling of blood in our lower extremities. If you have dysautonomia, you might have noticed that your legs get swollen if you are sitting for an extended period of time. And you might benefit from something like compression stockings on your legs and arms that helps prevent that fluid pooling. If there is fluid that's pooling in your extremities, that means there's less blood in your heart to pump to your organs. So increasing your blood volume might be compensating for that abnormally pooled blood volume. How do you know when IV fluid might be right for you? First, let's talk about who IV fluid is not right for. There are some medical conditions that make it very dangerous even to get a little bit of extra IV fluid. These include heart failure, advanced liver failure, and some kidney diseases like end-stage renal failure that requires dialysis. If you have these medical conditions, even a little bit of extra fluid throws you off balance, might cause you to have swelling or edema or fluid buildup in your lungs, and really throw off the way that your body functions and quite literally lead to an emergency. So talk with your doctor to make sure you don't have contraindications to IV fluid. Speaking of which, these IV fluid clinics are not appropriate for medical emergencies. Like I said, when I was really scared and feeling very unwell physically in 2021, I went to an urgent care center where there was a doctor, there were nurses, there was an EKG machine, there were medications, and there was a hospital, like a fully functioning hospital attached. In case I needed it. And that's not the case in IV fluid centers, and you should be well aware of that. So some things that are medical emergencies or require medical interventions is dangerously low blood pressure, a very high heart rate, new confusion, new weakness, a severe lightheadedness, and syncope or passing out altogether. Now, if you have long COVID, it is very possible that you have mild cases of one or several of these symptoms. In that case, you still might be a candidate for IV fluids, but make sure you talk to your doctor and get cleared first. Typically, we want to make sure that these symptoms have been worked up, that you don't have any gross or severe dysfunction of your heart, lungs, kidney, liver, and that getting IV fluid isn't going to do more harm than good. I personally get IV fluid or consider getting IV fluid when I'm in a long COVID flare that is taking a long time to recover from and is not responding to my typical interventions. If you've had long COVID for a while, you've gotten used to pacing your activities. You've probably also gotten used to recovering from a crash. I use a lot of rest, a lot of hydration orally, and I try to eat well. I also have some medications that I pull out as needed during these times. But there's some instances when I have a flare or post-exertional malaise where it's either the symptoms are either much stronger than they have been in the past, or they're not responding to my typical methods. Or they're not responding more quickly enough. And in these situations where my function has decreased, but I don't have brand new symptoms that I haven't ever had before, that's more of an emergency. And the symptoms that I'm experiencing are not way off the scale in severity as they ever have been in the past. I'm experiencing a flare of symptoms that I've kind of seen before, and it's really bothersome. And that's when I can get to an IV hydration clinic and see if increasing my blood volume will help my symptoms. If you want to learn a little bit more about how exactly I measure the severity of my symptoms, then check out my newsletter on this topic. It's a summary of today's episode, and it talks about how I measure my activities of daily living. It can help you communicate to your care providers, to your medical team, and even to your disability advocates, just how much these symptoms are impacting you. These kinds of measurements are even more important when we don't have clear biomarkers to track the progress or severity of our disease. We'll talk about what to expect if you visit an IV hydration center in just a moment. Before I do want to talk about the risks associated with IV hydration. So having an IV placed is a medical procedure. It is a very common medical procedure, but it is also an invasive medical procedure. Just because the little catheter is small does not mean that this is not invasive. It's a foreign object going into your body. So you have to treat it with a lot of respect. I'm going to say it now and I will say it again. Only get IV fluid from licensed and trained medical professionals at a clean, sterile center, okay? You can have infections at the site of an IV placement. You can have thrombophlebitis, which is when your veins get clotted off. There is a risk of air embolism, where air in the tubing of the IV fluid gets into a vein. And for some of us, we are at risk of that air bubble not just clearing out, but actually causing a stroke. And so we don't want to take that risk lightly either. There's also a risk of the fluid infiltrating or extravasating into the tissue around the vein. Sometimes catheters aren't placed exactly in the vein, and sometimes catheters move. That fluid from the IV tubing is continuing, and instead of going into the vein, it goes into the tissue around your arm, and you can have a swollen site that it itself can cause some problems. So I save IV fluids for those times that I really think I'm going to benefit from it, and the rest I use oral hydration. Subscribe to the channel if you haven't. I'm going to do another episode and write another review of oral rehydration salts. Hydrating by mouth is not just water. There's a whole lot more to it than that. And while you're at it, subscribe to the newsletter so you can get that and a whole lot of other resources straight to your inbox. I have visited sites that call themselves wellness centers, that are IV fluid hydration centers, that are drip centers, and I do the same thing every time before I sign the papers and walk in. One, I check the records of the facility. I make sure there is a medical license attached to the center. It's typically the medical director or the owner of the IV fluid hydration center. I get the name of that person, not just the business entity, and I look up that person, see their training, their education, their license. Then I take a look around and make sure things look clean and it checks the eyeball test. I ask who is going to be placing the IV, and I have always had a registered nurse place my IV. Extra points when it's a perioperative care nurse, because those are my colleagues and they have a lot of experience placing IVs and managing the complications of an IV. Once I want to proceed with IV fluid, I usually get a menu from the facility, and they offer me all sorts of stuff. There is 2 main types of IV fluid. Each facility usually has one of those 2 types, so I'll review those. One is called normal saline, and the other one is called lactated ringers. They are both sterile fluids, and they're pretty close to isotonic to blood. They come in 3 standard volumes for the most part. There are more, but at these fluid centers, you'll see 250, 500, or 1,000 cc's or milliliters. Cc's are cubic centimeters, mLs are milliliters, and they're equivalent volumes of measurement. I usually get 500 to 1,000 milliliters of fluid. 1,000 milliliters of fluid is also known as a liter. And I'll receive whichever fluid they offer, for the most part, for our specific needs. These are probably going to have pretty equivalent effects. After you decide on the volume of fluid you're going to get, they're also going to ask if you want any additives or boosts in your IV fluid. The menu is going to contain things like vitamins, like electrolyte mixes. Maybe some sites have enzymes like NAD+, and they will have descriptions on them saying they promote increased wellness, promote a boosted immune system, maybe increase cognitive functioning. None of that is really proven, and you're not likely to get long-term benefit from one dose of any one of those things. I skip additives when I get IV fluid hydration. It adds to the cost of the procedure, and it doesn't increase the benefit equivalently. So when I'm in a long COVID flare, I'm looking to increase my blood volume, and a vitamin is not going to increase my blood volume. We will talk in the future about vitamin replacements or vitamin therapy, coenzyme NAD+ therapy, peptides, and all of that. But the benefit of those is not because they're in an IV form or that they're increasing your blood volume. The mechanism probably has to do with that specific drug. And yes, they are drugs. Next, after you've picked your volume of fluid and your additives, you're going to go to another room or get seated in your chair and have your IV placed by a nurse. And I have been asked many times if an IV hurts to get placed. IV is a catheter. It is a flexible piece of plastic. It is a tube of plastic that sits in one of your peripheral veins. In order to get that plastic tube into the vein to connect it to the IV fluid, you have to insert it with a needle. But once the catheter is placed, the needle comes out and you're not sitting with a needle in your arm to get IV fluid. An IV catheter is different than the needle phlebotomists use to take your blood to run tests. And they're actually a little bit more difficult to place. It is a different procedure. So even though you've been an easy stick, as they say, for getting your blood drawn, it doesn't necessarily mean that the same vein is going to be easy to put a catheter through. So be patient with the nurse placing it. But yes, it does hurt because it's a needle going in your skin. Luckily, these IV fluid hydration centers typically use really small catheters, and that means the needle is very small too. For me, it feels a little bit more painful than a pinch, but less painful than stubbing my toe or stepping on a Lego. But, after taking care of thousands of people and placing all of these catheters, I have seen a variety of responses to having an IV catheter placed. Sometimes anxiety plays a role, but it's not true for everyone. We all experience pain differently, and for some of us, things are more painful than they are for others. What does ensure the least painful experience is that your IV goes in easily. And to increase the chances of that, one, use a small IV catheter. Two, what you could do is to hydrate as much as you can orally before you go in to get an IV. Keep your arms warm because warmth is going to dilate the IVs. dilate your veins and make it easier to get that IV in. And then the third thing is probably the hardest thing, but it is to relax as much as you can. When we get stressed, our blood vessels constrict and they get much smaller, which makes it harder. To get an IV, all of these things are difficult when you're dehydrated already and you're worried, but do the best you can. And it makes it even more important that you go to a really legitimate place to get your IV from someone who is experienced in placing them and someone who's experienced talking through the process with you. Is IV fluid beneficial for people with long COVID, and is it more effective than replacing fluids by mouth or drinking water? For me, it is more beneficial than oral hydration during the specific instances I discussed. There is a lot of research about IV rehydration versus oral rehydration. There just isn't a lot for long COVID specifically. So let's review what the research says on 3 different patient populations. That might help you decide if IV fluid is right for you. The biggest population where this research has been is unfortunately kids. Every year, too many kids die from dehydration from a gastrointestinal infection. So the World Health Organization has put a lot of research or collected a lot of research on what works best. Do these kids benefit more from an IV to rehydrate them, or can oral rehydration help the same and literally save lives? And they have found time and again that oral rehydration, using oral rehydration salt solution that they recommend specifically, benefits these kids as much as IV fluid does and reduces the risks of complications. The second group that is interesting to look at is athletes. There's been a lot of interest in boosting performance and improving performance among athletes using all sorts of biohacking maneuvers, IV fluid included. And essentially, we found that IV fluid does increase the rate of hydration, so you get hydrated more quickly than you would with oral rehydration salt solution, not just water. But the benefit kind of teeters out after about 3 minutes or so, and it gets equivalent. So right now, there isn't real hard data to support the regular or routine use of IV fluid for recovery in athletes. The third group is people with postural orthostatic tachycardia syndrome, or POTS, which is a type of orthostatic intolerance that many people with long COVID have. Most studies in people with POTS are small. There are studies in children with POTS, because this is a disease that often hits at a young age, that demonstrates changes in improvement in cardiac output, in cerebral blood flow, in stroke volume. These are measurements of perfusion to the organs. And these have found that IV fluids increase these measures as well as oral rehydration salts do. Studies that are once again small but are in adults with POTS or myalgic encephalomyelitis demonstrate an improved quality of life in people who are treated with IV fluid after a single infusion and in populations who've received IV fluid regularly over an extended period of time. The benefit is in reduction of symptoms and improved quality of life. And the benefit lasted not forever, but for several days. This points to the potential use of IV fluid to relieve patients of symptoms, and something that can be used intermittently as a rescue from the worst or the most severe symptoms. What we're seeing in this research is not significant changes in measurements of perfusion, but we are seeing improvements in quality of life and reduction of symptoms. And that clinical endpoint is very, very important and something that we can't ignore. This is why I say I am following the science when I seek IV fluid during a long COVID flare, because I am. There is a science-backed reason for my choices. Unfortunately, where we are right now with long COVID research, we just don't have data on our specific subset and our specific needs. And identifying treatments that are safe and potentially worthwhile and have some reason behind them is very, very important. So if you are considering IV fluid, make sure you don't have contraindications. Talk to your doctor about it. If you're shy about talking to them or don't know how to start the conversation, subscribe to the Substack. There's an attached worksheet that summarizes what we've talked about here, includes links to the studies I've mentioned, and provides some rationale in using IV fluid hydration for long COVID symptoms. You can use that as a jumping off point to talk more with your healthcare provider about this as an option for you. My goal here at Long COVID MD is to make sure that you make your decisions safely, that you avoid putting yourself in any more danger, and that you have a platform to share your experience with others. So let me know if you have used IV fluid, what your experience has been between an urgent care center, an emergency room, and an IV clinic, and anything else you want to tell me or questions you might want me to answer in a future video. Take care of yourselves, and bye for now.